Hi, I'm Dr. Kenny Levine. Welcome back to Health Talk. We're seen on WEYW19.com, UVerse Channel 19, and Comcast if you're down south, and Comcast Channel 87. I'm here with Dr. Jason Altman. What do you enjoy most?
The two most common procedures that I perform, both based on need and my expertise and what I enjoy doing, are breast augmentation and rhinoplasty, and that's what I was hoping we could talk about.
Well, let's talk about it.
Great.
Little girls grow up and they want to have big boobs, and some do and some don't. Some have become too big, and most feel that they're too small. So let's talk about what options you have for them.
For many, many years in the United States, what we had available were the saline breast implants.
Right.
And that's essentially a silicone bag filled with salt water, the same solution you would get in an IV if you went to an emergency room for dehydration or if you were having surgery. These were what was available for the 20 years when the silicone implants were taken off the market and being studied by the FDA.
That burst?
Yep. Actually, every implant that we use can break. They just behave differently when they break. These are known for breaking because if they were to break, because they're filled with a liquid, that liquid would leak out, and you would notice one breast smaller than the other.
Well, now that it's filled with saline, which is a part of our body, is that a problem?
No, your body would just absorb it, just as if you had an extra glass of water that day, or if you went to the doctor and got an IV. Okay. It passes right through your system, through your kidneys, and out your body, just like any excess fluid.
And all you have is the...
And you're left with the bag.
The bag.
Correct.
Okay, so what are the improvements now?
So the newer implants that are back on the market, once the FDA completed their studies and decided that these were, again, safe for use, these are what are called silicone gel implants. There's 3 manufacturers that make these implants in the United States. You can see they feel a lot more natural than the saline implant. They're a lot softer, and they tend to flow and feel more like natural human tissue.
So when a woman would lie down, she wouldn't have this mound?
You don't get that artificial false fullness at the top.
Right.
There's also a lot less likelihood of noticing the ripples or the wrinkles on the edge of the bag like you can often see with saline implants.
Okay.
These are filled with what we call a cohesive gel. The different brands use different brand names or trademarks for them, but it's all the same concept. It's not really a liquid in there, it's more like a gel. Imagine a Jell-O mold, so that if this implant were to break, the material inside would not leak out. It would maintain its form. The material wouldn't enter the body. The older implants that there were concerns with back in the 60s and 70s had a more liquid or less viscous material that could then enter into the tissues.
So this would stay in place?
This stays in place. In fact, it stays in place so much that if it broke, you probably wouldn't even know that the implant was broken. So we do recommend you keep your eye on them. The FDA recommendations are that every 3 years you have an MRI or some sort of imaging study to check the integrity of that implant.
Okay.
If it were to break, at this point we are not aware, don't believe there are any safety hazards from the implant being broken, but the implants are guaranteed for life and the company will replace them if they break. So if they're broken, best that you find out and have it taken care of.
Okay.
What I have on this side is the newest product to be released in the US market. They've been used for many years in South America and Europe, and these are what are often referred to as the gummy bear implants. These are often mistakenly called gummy bears. The difference is that this has a much higher cohesivity or a much thicker gel. It's more like a solid. If you feel it, you'll notice it's a little firmer. Mm-hmm. The most striking difference you'll notice is that there's a coating on this implant that's a little bit different than the smooth coating on these. The reason for that is this high cohesivity, if I can grab that from you from just 1 second, allows us to create an implant that has a shape to it. So as opposed to this implant, which is round, this has a more natural, a teardrop shape, if you will. The truth is, the regular gel implants will take that form on in the body, but some women are more comfortable with the more natural look of these. That extra cohesivity also maintains the fullness on the upper part of the breast. You can see this implant stays up, whereas this one tends to collapse a little bit. The reason for that texture is that helps to prevent that implant from rotating. Helps your body heal a more tight pocket to that implant and keep it in its position. Doesn't mean it won't rotate, it just means it's much less likely to rotate.
Now you get fibrous tissue attaching to that?
With any of these implants, the body will build what we call a capsule, which is very similar to scar tissue. With the smooth implants, that capsule will be smooth and loose. With a textured implant, it will be tight and hold that implant.
You know, it's
in a
interesting.
tighter pocket.
With dental implants, we have the same thing. They used to put in polished implants. Now everything has a rough coating, so the bone has more surface area on which to attach
to hold on to.
So it's the same thing.
Perfect. I do recommend doing them under general anesthesia. There are surgeons out there that do them under local or under sedation.
Right.
My feeling is it's safest when the patient is completely asleep and there's an anesthetist or an anesthesiologist monitoring the patient during the procedure.
Okay. I'm going to be back in just a moment. We're going to continue with this. I'm Dr. Kenny Levine with Health Talk, WEYW19.com, and UVerse Channel 19. See you in a minute. Thank you.